Hello, welcome to Medical Dialogues. I'm Roshni. Let's look at today's top news. Johnson & Johnson faces 18 TaintedTal cancer trials, prompting it again to consider bankruptcy. Johnson & Johnson faces at least 18 jury trials over the next year tied to claims of tainted talc in its iconic baby powder, prompting the company to consider a third bankruptcy filing in hopes of fostering a global settlement. J&J has talc cases set for trial everywhere from Pennsylvania to California between November and December 2024, some of which involve consolidated claims by more than a half dozen plaintiffs, according to their lawyers. Those trials were scheduled after a judge in July threw out a J&J unit's latest Chapter 11 case aimed at resolving all current and future talc claims. J&J has removed its talc-based powders from the US and Canadian markets, replacing them with a cornstarch-based version, and plans to phase out talcum powder worldwide. The passage also mentions upcoming trials related to talc claims, including one in Oakland, California, and others in New Brunswick, New Jersey, and Philadelphia. These trials have generated sizable awards against the company in the past, although some were later reduced or overturned. Are you also aspiring to excel in medical journalism and delve into the intricacies of health and medical reporting? Explore our comprehensive course on medical and health journalism available at the Medical Dialogues Academy. Learn from industry experts who possess in-depth knowledge and experience in this field. For further details, scan the QR code provided or access the link in the description box below. In LLRM Medical College, another doctor booked for beating up patient kin. Following the suspension of 3 junior doctors on grounds of alleged assault against the relatives of a minor patient at Lala Lajpat Rai Memorial Medical College, another junior doctor has been found to be involved with the case. The involvement of the 4th accused doctor in the case was brought to light by the police investigation of the viral video circulating on social media and the complaint of the victim's family. Although a case was registered against 3 doctors under Sections 147, 323, 504 and 506 of the IPC, the 4 doctors' name was added later to the case. Hence, the 4th accused doctor in the case has been booked under sections of the SC/ST Act along with 3 other doctors who were earlier suspended based on their actions. During a planned meeting, the victim's family submitted a memorandum to Arvind Chaurasia, the circle officer of the civil lines area, expressing their concerns about the incident. As a result, an extra section of SC/ST Act was added to the case. Did you know that hot yoga might hold the key to reducing symptoms of depression? According to recent research from Harvard Medical School's Massachusetts General Hospital, published in the Journal of Clinical Psychiatry, suggests that hot yoga may significantly elevate symptoms of depression. The study found that engaging in hot yoga on a weekly basis for 8 weeks led to a 50% or more reduction in depressive symptoms, with 44% of participants achieving remission from their depression. In this randomized clinical trial involving 80 participants with moderate to severe depression, researchers divided them into 2 groups. One group was prescribed a minimum of 2 90-minute hot yoga sessions each week, while the other group was placed on a waiting list. On average, the participants in the yoga group attended 10 yoga classes over the 8-week period. The study results showed that around 2/3 of the participants in the yoga group experienced a significant reduction in their depression symptoms, in contrast to only 6.3% in the waitlist group. The effectiveness of hot yoga as an antidepressant may be attributed to its combination of 3 potential therapeutic elements. First, a mind-body connection. Second is physical exercise and movement. And third is the application of heat. A Congress MLA treats patients in doctor's absence in Odisha's Rajgangpur. Congress MLA CAS Rajan Eka in Odisha temporarily assumed that the role of a doctor at a community health center in Rajgangpur due to the absence of medical staff, drawing attention to healthcare issues in the region just ahead of the state's assembly elections. C.S. Rajan, a former Indian Army doctor with an MBBS degree, stepped in when he learned that the CHC had been without doctors for days. His actions, which included diagnosing and prescribing medicines, went viral on social media, highlighting the urgent need for healthcare improvements, particularly in underserved areas like tribal-dominated Rajgangpur. He promised to bring this issue to the government's attention, emphasizing the importance of accessible healthcare for all. That's all for today. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.